So welcome, everybody. Thank you for being here on a Saturday. It's a gorgeous day. You'll have plenty of time to enjoy it after this 1-hour workshop. And I'd like to introduce Michael. I emailed everybody. There's a card there in case you need that. And I did share a little bit about my thoughts in the email about Michael. And I met Michael many, many years ago. And if I may say, he was a different person when I met him. His very demanding, many responsibilities, very demanding job owned him, if that's fair to say, at one point. He'll expound. And, very subluxated. And so I was blessed to see a man transform and want to change the course of the trajectory of his life, and took action to do it. And I props to Michael. So Michael Daniels, we're 2 days apart, by the way. I was like, very close.
It's important.
It's an important detail. He'll connect kindred spirits. And so he decided to leave it all. Very successful career, and his healing journey wasn't local. He, I call him the most worldly therapist I know now, because travel the world. Because when Michael wants to learn something, he wants to go to the founder of the work, right? The experts, and get it straight from them. And I respect that so much. And so anytime he'd go away, he'd come back and check in to make sure he was aligned. I saw him heal and transform, and he less and less than me, which is always my goal for everybody, is to be able to hold an adjustment, heal, and the whole premise of chiropractic is the power that makes the body heals the body, and live that and put that into action. So I'm going to bring Michael up now. Let's give him a warm welcome.
Jeez. I'm Michael Daniels. You all can call me Mike now, since we're here and everything. It's very more informal. Yes, so I'll get into my story in a minute. What I just want to mention is this is something that I just created. I got sort of pushed into it a little bit faster than I thought it would happen, but it's kind of a part-time business to help people and to share the things I've learned and how I've helped myself. And what really pushed me into this is I rebuilt my parents. So my parents are, mother's 78, father's 85, very active. Zumba, my father goes to Zumba 6 days a week. My mother's yoga, they both walk and everything. And I had a 3-year plan, when I'll talk about, but when I left work, and then we had the COVID issue, and then my father broke down because he was doing too much exercise, and all his old injuries came back to haunt him. So his leg gave out. So this really, after I was using this on myself, it triggered me to really get into it and study hard. And go through the certification process to help him, to rebuild him. My mother came down with, she had to have a second hip surgery, anterior hip surgery. And what was also going on is problems in the lower back because of the first hip surgery. So, okay, well, I'll rebuild her too. So they're doing fantastic now, and 95% of the way fixed, and they're back into classes and doing everything again. So it was a great learning experience, and they put in the work to make themselves better, with a little bit of my help, I guess. So this is a quote that in our classes that always comes up, and I think the gentleman's name who said this originally is Perry Mickelson. down in LA who does lymphatic stuff. But the body is under no obligation to make sense to us. We like to think that, you know, in the whole medical profession, there's just something you have, you go to somebody, and everything's great afterwards. Not so simple. Every individual is different. All have different histories. And the interrelatedness of the body is very difficult to diagnose. That's what we're trying to do here, is figure out what the root cause is. Happy Valentine's Day. Why is this here? Am I just late this year? About a month late or something? No. I'm single, by the way. And I celebrate on this day, on Valentine's Day, because I'm still single. The reasoning why I do this is my story. So I'm going to run through a little bit of sequences of events that I learned about myself after getting into studying all this and going back through history, tracing what happened to me. And then we'll get to Valentine's Day. So when I was 16, I was an avid skateboarder. Badly sprained my ankle. Went to the doctor, ankle's this big, black and blue, everything. The doctor said, you should have broke it. Because then the structures around there, the ligaments, would have healed back better. So instead, in a badly sprained ankle, they can stay stretched, get overactive and underactive to try and protect that structure. That went on. At 21, I was in college up here, and grew up in Vallejo, live in Benicia now. I was up here in college, decided to weightlift. Was doing some heavy deadlifts, didn't know what I was doing, back blew out. No idea what this is. Laid me up for 5-6 days, whatever it was. After that, every roughly 3 years, I'd blow my back out. So that could be mowing the lawn for my parents, just reaching down, blow out, 5 days in bed. Something ridiculous. That kept going on. I'd get better, kept going on. About 36 or 37, I was in grad school and developed sciatica shooting down my leg. Left side. And it wouldn't go away. So I basically got to a point where I was limping everywhere, was completely miserable, emotionally drained. Go to the hospital. Well, we got to go through some steps. I go to physical therapy. They said, you're too far gone. We can't even deal with you. So then I went to the shots. 3 shots into my back. One of them worked, I'd say, successfully for 3 months. The other 2, no. Okay, well, we got to do surgery. Oh, I went on the pills, the Vicodin, also to numb the pain. Well, that's a story in itself, but obviously that's not good, right? It just takes away the pain. Go into surgery, and that was on Valentine's Day, 2008. So I got better. I didn't have too many difficulties out there after that. But the problem is, when we wind up having surgeries, obviously it creates a scar. Okay. In NKT, the first thing we deal with is scars. Come to find out years later. But the problem with the scars is how they heal. Scar's not going to heal perfect. Certain parts of the scar is going to heal better than other parts of the scar. It also starts cutting into the fascia, which deals with some sensory issues. That's going to pull your body in a certain direction. So that's going to start creating imbalances in your body. So over a period of time, for example, I have a 1-inch lower back scar, but it turned my body this way. So then I started turning this way. So it affects the entire chain, your neck all the way down to your ankles. I developed a ton of pain. So what I did is I managed the grid system over here at SMUD. So it's 12-hour shifts, days, night shifts, back and forth every week. A lot of sitting. That causes problems in itself. Plus I had the scar issue. Tons of pain. I couldn't handle it anymore. It came to a point where I said, this is a non-negotiable. I love traveling, exercising, moving around. I want to be successful in what I want to do when I'm 80 years old. So I walked out, probably about 5 years early. And I said, I'm going to solve this problem before and if I go back to formal work. Any way possible. I'm going to investigate everything. I'm going to travel the world, see what I can learn. So I found NKT in 2000. I found that actually before I left, but didn't start studying it until I did leave. So that is what brought me to get my body much more in balance. What is NKT? So neuros, obviously, we're talking about the brain here. It's manual physical therapy. So we're using our hands. We're testing muscles with the brain. It's essentially the nervous system, and we're trying to find the root cause of pain, where it's actually coming from, through testing muscles and the imbalances that are created in our muscles. So if you think about it, what we think of is, oh, my hip hurts, or my hip's weak, I can't do something with it. Okay, well, if that's weak and not working well, something else has to be overworking to balance that out. Something's going to compensate for that weak part of your body. It's not just about strengthening that. You have to figure out. That is what, when I understood this from somebody I was going to, the light bulb went off in my head. That makes total sense. In our brain, we have the cerebellum. And this is where all our movement patterns are stored. This is balance, anything you can think about in regard to moving. Muscle relationships. So anything I do, if I wanted to pick up that cup of coffee, I have to create that in my brain first. I have to say I want to pick up that cup of coffee. That information is going to start somewhere else, but it's going to go to the cerebellum that's going to create that pattern, and these are all milliseconds, to say, hey, I got to go do this. That's the communication channel down the spinal cord. This is where she comes in. Up in that top area. So, in NKT, what we're trying to figure out is which muscles are strong, which ones are weak, and then which ones are actually related to each other. So we could do this by manual therapy. I could test how strong my arm is right now. That's just touching, forcing it to work to connect through the spinal cord up to the cerebellum. That's all we're doing. If I can push this down, it's weak. Obviously, if it's here, it's strong. It's a simplification. But a very simple common example is we get tightened up here, our upper trapezius, or We have other muscles back here that could cause, mostly it's our trapezius, we're up here. Over a longer period of time, we start using this instead of the shoulder. So the shoulder will be weak. I can go in and test this at the same time, and this will go strong because it's relaxing this. It's a very simple relationship, but all this touch will communicate into the brain. Now, so before we go on, we'll get into the kind of the differences here, the hardware versus software of the body. Chiropractic. We're here with Desi. So she's dealing with the hardware side of things. Okay. This is something that I developed. I have a twisted neck here to the right. C1, C2. That's affecting all the way down shoulder blade. And I could feel it down through the middle of my back. When that's stuck there, obviously, the subluxation, when that's twisted, this is the communication. So you guys probably learned all of this in the intro, if you're still doing those things. But this is straight because of that communication through the cerebellum. If the spinal cord is getting pinched in some way because of that twisting, we're going to have a communication problem. If we move on to the software of the body, that's the muscles. Muscles, ligaments, anything else could be imbalanced like I talked about before. Here, trying to strengthen those back up. This is also ligaments. I just took a class actually on ligaments and figured out what was wrong with my ankle, which ligaments were actually overworking, which one was underworking, and trying to protect my foot and my ankle. When that occurs, the ankle could be twisted a little bit. Other parts of the foot can't move properly. So if there's walking or movement, the foot will turn into a stilt just slightly. But that will affect everything up the chain, as we'll see. So this is how is NKT used in practice. So I'll go through a few examples. Feet, ankles, just what I sort of started mentioning. I'll give you my issue. I was over here, supinating my foot. So it's my left side. If I test myself, my ankle wants to go this way. It's going this way to protect itself from the sprained ankle. So what that does is starts moving problems up all the way through up the entire body. Because this turns more into a stilt. And my ankle can't move forward as much as it should, limiting the bone structures and movement. So we could wind up with problems in the knee. That could lead to problems in the hip. I don't know if you guys can see it very well, but the lower spine or the mid spine can start a little bit of a curvature. And in my case, my hips were twisting this way. And then we go up to the neck, coincidentally. Our shoulders get uneven. What happens in that case? Rotator cuff issues? Could that develop as a problem? Because we limit the spacing between all the structures in the shoulder if we're off center. And then we start using the shoulder incorrectly. Maybe we start using that upper trapezius a little bit more. So over time, this stuff compounds on us. So when we look at the case, and we have my case here, It started with me in the ankle. But we want to know, where does this pain actually develop? Where does it come from? Just because there's some studies out there that have shown that, for example, roughly 91% of people who experience pain in their knee, it's actually because of their ankle or their hip. This is just the outlet. So just because something is hurting or you feel pain there or it's stiff, doesn't mean that's the source at all. So what we do in NKT is we're trying to find the root cause with history and through muscle testing. Example 2, very common today. So I just worked on my niece, and she's 17, getting ready to go to college, last year of high school, stressed out. She had migraines, athletic, works out, does everything. She comes in and it turns out her entire front part of her body wasn't working. The whole backside was completely locked up. It was overworking. And this is a very healthy 17-year-old. And it's all of this. So, when we're looking at the body and what's going on today and the leaning over, this could be a little more exaggerated. But you can see where lower back issues can develop here. That erector spinae is just our lower back muscles. That region. That winds up compressing. So we're like this. Compresses our back. Because the front gets too tight. That shuts off our butt. Okay? And that's extremely important in what we call gait, which is just the walking movement pattern we should be doing. But because of our lifestyles, we stop using that. And we're more like this. And over time, we can get into waddling. Right? Some exaggeration of waddling. But if we go higher up, you can tell the head here is forward. Okay? That's the neck flexors up here. We have a few different muscles there. When we go forward, these tend to shut down. The back of the neck, and there's the trapezius that I mentioned before, and one of the other muscles, the levator scapula. These overwork. So we're doing that. That's where the hunch comes from. The whole middle of the back, essentially, if this is like this, the middle of the back, this isn't working anymore at all to keep us upright and normal. When we're also here, our pecs tend to get really tight. Somewhere in the front is pulling us forward. Now, I can't exactly remember here. Okay. Now, if you think about it here, if we do this, what eventually happens to the shoulders? Well, they're not exactly in the socket anymore. Right? So, repetitive movement, motion, rotator cuff issues somewhere, most likely. But probably the more important thing here for life is what else is happening. What happened to the picture? Oh, there it is. I didn't set that. I wonder why that happened. Okay, rib compression. So we notice over here how that's collapsing. That happened to me, and I'm still even working on that, working that out. That's rib compression. So if we think about breathing, well, let's think about food first. How long can we fast before bad things happen? Number of days, right? How long can we go without water? Not as long, maybe a little while, but bad things will happen. How long do we go without breathing? Not good. So Logic would say if we limit our breathing in some fashion, we're not going to be as efficient in our body as we should be. When we get this compression here, we start breathing more with the belly. So the breathing process that should occur, if we look at babies and how they actually breathe laterally. So over time, these muscles in our chest, because of what we see on the left side, as we age, the muscles in between our ribs start getting tighter and tighter. So we start becoming more belly breathers and shallow breathers just in the belly. This locks up. We can't do the expansion. These ribs aren't expanding to the lateral side or to the front, but mostly to the outwards. When that occurs, we're not getting the oxygen we're supposed to be getting to our cells. That gives us energy eventually. Number 3, sciatica. I don't know if anybody experienced any leg things going. You've had some of it. There's a wide variety of symptoms and issues with sciatica. It's not just a lower back issue. So this is about the lower back. So you see the source there. How the sciatic nerve comes down. Right above the back of the leg, it splits off. So this is the outside of the leg, the peroneals. That's where that nerve goes to the top of the foot. And then we have the tibial nerve that goes to the bottom of the foot. Same source for the nerve, they just break apart. So if you've experienced it, you can feel things down your toes. It's kind of the numbing or like fire ants, or there's a few different things that can happen there. But what else could it be? Has anybody heard of piriformis syndrome? Okay, a couple of head nods. Okay, so roughly 30 to 35% of people who experience sciatica, it's not actually a lower back issue. There might be some issues with the lower back where you think it's coming from. But again, if we're compressing our lower back, everything around the hips is going to function differently. So we have a bunch of muscles here that are inside our hip. The sciatic nerve goes through those. These help us turn our leg out. But if we don't have the issue here, this nerve and these muscles, when they get tightened up because of some imbalance we have, could pinch that sciatic nerve. You're going to feel those effects all the way down, just like sciatica, but it just might not be that lower back. That might not be the issue. So in NKT, this would be a root cause analysis. Where is it actually coming from? What's the actual cause? So what I want to show is that where medicine is going, what we're doing today. So is anybody familiar with Peter Attia at all? So he's a little bit, you've heard of him. Okay, he's kind of he has a very big podcast. He's kind of on the cutting edge of what's going on in medicine and optimizing the body. So this is his book out there, Outlive, comes from there. So it's kind of where we're going with Medicine 3.0. And this is, without intervention, we're looking at our lifespan, how long we're living, obviously, But what we're trying to do, and this graph is trying to show, is our health span. So instead of this gradual, decline for a while, and then we hit 50, and then everything just collapses on us, and we live another 30 years in misery. We had medicine 2.0, where they may be able to help you with a functional life a little bit longer. And then you can kind of get into the drugs and everything else to keep it going. With technology and these new realizations, we're trying to get to medicine 3.0, which he would talk about in his book. So what that is essentially is getting more intimate with your body, understanding yourself a little bit more. All this time, what we've been doing is we just go somewhere and they tell us what to do. But we know we're the sickest country in the whole world, or very close to it. So something hasn't been working. Where we're going here is to spend a little time understanding yourself a little bit better so you can help yourself. In NKT, what we do, we work a little bit more intimately with the client and try and show them when you're searching for these root causes, you find a root cause in a relationship, what's weak, what's strong, and then how to balance those out. We'll give homework. So, and the homework will be related on that. So you understand that you have a strong muscle and a weak muscle, and then you work each day to change the pattern in your brain. So it's just repetition. The brain learns from failure, and it'll rewire itself. So the homework is 3 to 5 minutes, a couple times a day. It may take a week, it may take a couple of weeks, but eventually your body will relearn how to create the proper pattern. Then, if you have any issues and you wake up one day and you're just, oh, this came back. Oh, I know what to do. You know exactly what to do. That's the intimacy. So, with healthy body restoration, I mentioned the intimacy. What I tried to do around when I left work, there was a lot of deep soul searching at the time. But I wanted to ask myself questions. So what did I want? And as I mentioned before, it's at 80 years old, what do I want to do? Well, I want to travel, I want to experience cultures, I want to be able to exercise, I want to go for a walk, I want to be able to squat down, whatever it is. I want to be able to do that. So then I also asked myself, well, the basic thing in the body, what should my body be able to do? And why can't it do it? What is the issue here? So, we went through like the medical number, medical 1.0 or 2.0. There's a lot of this, well, I'm just getting old. Well, is that really true? Is it true, or is that something maybe some doctors just say is that, yeah, you're getting a little older, you should tone it down or whatever else? I don't know. I'm not sure I buy into that. So what I try and look at, I tried to boil things down. And if we look at a baby, what do we see babies doing? When they're squatting, they're just able to go down and they sit upwards, right? So why can't we do that anymore? What limits us as we age to not be able to do this? So what I try and work with, in generally people who are older, is we should be able to squat and we should be able to hip hinge correctly. So when we get those tight backs, right, we start doing other things. It's not correct on the hips. So we should be able to do correct hip hinging along with the squatting. So that's where I started with when I first left work, is I need to be able to do that again. And somehow that'll require rehealing the back. So to repeat from the beginning, a chiropractor is important because of those structural issues in our body, that hardware. If that's stuck somewhere, you're not going to have the proper communication for your body to tell itself how to heal. Balancing muscles out helps with our patterning. It helps with our daily movement. It helps to reduce pain. That's it. So thank you very much. Appreciate your time. And questions.
We can open up to questions. Well, I have questions, but please, I'll let other people questions. If it's especially personal to your own condition.
How do we do on time?
Oh,
Did
you know,
I-
he always wants to respect time, and you're ahead of schedule, and that's why we have Q&A time.
Okay, good.
That's great. So, question?
Yeah, no question. So you do muscle testing to find what's weak and what's strong. And then do you do, as a practitioner, any hands-on work, or is it just you're giving the person exercises to do?
No, I do a little bit of hands-on work, but this isn't massage. I'm not providing massages. So the process would be, let's see, how would I do this?
Can you demonstrate something?
Sure, I could demonstrate it if you want how I would do it. Okay, what's your problem?
I have neuropathy in my hands.
Neuropathy in the
For 3
hands.
years.
Okay, so was there any shoulder issues?
Is there any shoulder?
In your like trauma history and injuries to your shoulders?
No.
No, you didn't.
No.
Is there?
But shoulder tilt, hip rotation.
Oh, is that okay?
That's in her history.
Okay, I'd have to do extensive testing, but so it would just be with the shoulder. So I'd have you laying down on a bed or whatever else, but it did say this was weak. It wasn't working.
Mm-hmm.
So in this, you turn around over here a little bit. So let's say she was really using this trapezius too much. Okay, so we do something what's called therapy localization.
Hmm.
So this, if I'm touching you in some way, this is communicating to your brain. So it would change the pattern where I'm touching here. So if I touch here, right, say this was your problem area, this is weak.
Mm-hmm.
If I got this into the pattern and had it relax, this should go strong. If this was the issue, this would wind up going strong.
Okay.
So I do a little more testing to validate that these two were actually related to each other.
Mm-hmm.
And then what I would do is actually release this. And it's a simple process. It's different in every case, how much you need, how many sessions, whatever else. But you would relax this to get this to freely move by itself and connect with the brain, rather than going through this channel to help you. We just want your arm to work, the anterior front part of your arm.
Okay.
We just want that to work by itself without help here. So the idea is to eliminate this in your use of your arm, which puts pressure on your rotator cuff. We don't want that.
Okay.
So that's what we would do. So after I'd identify that and figure out those are related, what I would do is assign you some homework.
Okay.
Each day, which could possibly be like using a softball of some sort, maybe in a doorway, and just releasing this, and then some strengthening exercises here. So you could do this on your own without the use of this.
Okay, and your release of this as to relax it is would be just a manual touching of it, or
Yeah, it's something can be that simple. This isn't going in and really grinding away.
yeah.
It's just, this is all communication. It's all nerves.
What you just demonstrated, you said a softball or whatever, is softball in shoulder, then that turns off that muscle while she's doing some exercise with the arm? Is that
Essentially, yes. That's what it would do. You're just releasing that muscle from its overactive status in helping you raise that arm. We just want that arm to work by itself.
Are there areas in the body that you as an individual get to? The iliacus kind of.
Oh no, work on iliacus all the time. That's a bad one. That's anterior tilt. Real bad one.
You know, they have these tools, to get to that, you don't want to need it.
Yeah,
Buying that, whatever it is, I can't remember what it's called.
yeah. And I'll take the words from the gentleman who founded this NKT. He's actually a Marin, so he's actually close. But the woman who invented the main one, I think. Yeah, I don't know the details, but he had said in one of our classes that woman approached him to promote it, that they had a similar thought process or whatever it was. And he just said, no, I don't want to be associated with it. The problem is that this is the issue with muscles in the brain, right? So we have a tight iliacus, but what is it overworking for? So in general, I'm just putting percentages on it, but in a lot of cases, if we have a tight iliacus, it's the development because our back muscles are protecting something in the spine in the lower back. So we have to over-rely on other hip muscles. So these get tight. So something else resulting from that is going to become weak. So we're going to be tight here, tight here. Some other muscle, hamstring, quads, probably the psoas, right? So the iliacus, if that's overworking, it's probably going to shut down the psoas. Those need to be balanced out. So we'd have to go in and figure out which one's the iliacus in this case, overworking. What's underworking, pair those together, confirm it, release the iliacus, and then strengthen the other muscle. And get those balanced out.
So when you say you press here, are you like trying to hit the trigger point there, or like what exactly are you trying to say?
Well, so that's a good question. There is, I can't remember exactly what it's called, but there are the trigger point thought processors, right? So in each muscle there, most of the time, there will be certain spots, right? But again, every single body is different. So where I would investigate is where I'm getting the strongest signal within that muscle in order to make the weaker muscle work the best. So you could have multiple trigger points along that trapezius in this case. So if you have the different points, I would try and figure out which spot gets the strongest response. Yeah, so it may or it may not be the traditional trigger point. Just unknown.
To piggyback off that, and you can correct me if I'm wrong. So you're saying that, say you getting soft tissue therapy, manual therapy from practitioners, massage, and they're hitting trigger points that are relevant, but they're not releasing the primary that you would find, right? And say with your testing,
Right.
right? Or they're finding it, but they might obviously not be fully releasing that,
Right.
for lack of a better word.
Right.
So that would reoccur until that, like the core cause
Yes.
is resolved.
Exactly.
Yeah. So
Exactly.
are you finding that patients, clients who go to you, need less and less massage when you are coaching them and they're doing their homework? Do you notice that, like with people that you're working with?
I think.
Or is it just complementary to it?
I'd say it's complementary, right? These different modalities do different things.
Right.
We just advance in time with our knowledge, obviously, in everything we do in society. Massage is great for blood flow, the lymphatic system. You know, it's kind of a broad thing. But it's not trying to solve an imbalance in this manner. This is solving pain and mechanical type issues in the body. As far as specific issues, I don't think I've actually discussed with anybody whether they're getting massage or not. It's not something, it's just a history of the pain and what's going on, pretty much. So, yes.
In demonstration, you're talking about trapezius is overworking because you rotate the cuff.
Yes.
So, and I realize it could be many different issues, but so that is caused by like you having something, and does that then start becoming sore or just overwork? Tender, I guess, the trapezius.
The source and why it actually develops could be very specific to the client. It could be an accident, right? So some things that I've dealt with, or a couple, is whiplash, right? So that'll trigger, whiplash will kind of trigger an imbalance in the muscles in the neck, amongst other things. But that's a shock to the system, instantaneous, right? So that's going to create a protection route in your brain, a new one, instantaneously to protect your neck if it was really bad. In this case, the rotator cuff, like the rotator cuff decaying over time, right? And then you start using the trapezius as a compensation because of that the rotator cuff decaying over time. That can happen. It could come from injuries, or it could come from just our society doing this, right? It could be multiple things. And that's what I would try and solve. Where is this coming from, right? It's getting to the root of the issue. Yes?
So is the length of time that the time that it is healed like this? It's like, not it's something that's been there a long time, take longer to help with this, or is it all the same in that?
It depends on the client, and it really because of the individual nature of our bodies. That being said, it's dedication to the homework. That's done at home or the gym, right? I can supply it, but you have to be dedicated to it. So it may resolve itself in a week or 2 weeks, or maybe it takes a month. I'm just not sure until we look at it. So.
Well, follow up. So I've had myofascial release.
Uh-huh.
Some success with that, and then also reflexology,
Mm-hmm.
and moved away from very difficult situations. But it sounds like what you're offering is more of me, myself, and I, and helping with this rather than just going to someone?
Yes, it's more of a relationship. And that's kind of one of the reasons I do this part-time is, I like working with people that want to be dedicated, who are like me in a way of just being tired. They're just tired of the pain and want to help themselves and take an interest in it. And it's not a lot of time. It's the repetition of just doing it. 5 minutes in the morning, 5 minutes at night. You just have to be dedicated to that. That's it.
How long are your sessions? How long does it take you to actually get to the source? Because you showed that, you have to change. How long does it take you to get to the source?
When
you actually get to the source.
Yeah, when are you going to fix me? That is really a good question, and very common. So the way I have it set up now is I do an initial session, which is an hour. Right, it's kind of the intake history and taking a general look. After that is, I don't know how long the session's going to last. Right, it could generally an hour to 2 hours, because it's reviewing, it's testing, it's I'll put you through some motions to see how you react. It's a little more in detail, so I kind of keep that as 1 to 2 hours in there. I have no idea. I'm searching, and we're working together to solve your problem. That's just pretty much what I can say on how we solve it. Now, how long does it take to actually find where the root cause is? Well, I view it as my job is to get you back into your life and away from me as fast as possible, and you understanding your own body and have new intimacy. That's my goal. I want you to go live the life you want to live, and happy and out of pain. So through learning your history, that could give me an idea where to go, possibly. After the initial session, what I'm exploring, I might have to go back and do research. If you have like really specific issues or the doctor diagnosed you with something, I might have to do research, apply it to NKT, and then figure out the best strategy for you to figure out where your root cause is. Because I want to get in, help you out in that hour or 2 hours, and try and find what I can. There's obviously some key things in the body of where things are, right? Hip, ankle, neck, maybe some of the back, scapula. Generally, somewhere around there is going to be the problem that I can get to. But it's that actual relationship between the strong and weak muscles that we're trying to get to. So sometimes I could unearth something, some relationship, release those are better. It may expose something else that I don't know. The body is very mysterious in that way. So I wish I had an exact answer, because that would be great. Hey, it's 2 sessions and you're going to be back running a marathon. I wish it was that simple, but you have to be honest, as we're trying to work together to find out what's going on.
Well, then, like in the case of your parents, or let's say I have a friend who's on the verge of knee surgery.
Mm-hmm.
Now, if you worked with her and found and corrected that, imbalance, would she be able to avoid knee surgery?
Well, I'd have to do a full assessment there and look at what the doctors said.
The body would that way, would she get things aligned? Would she change?
Oh yeah, that's what we're doing here, is trying to get everything in balance, opened up, the proper communication to the body, and then allowing the body to do its work. What we do is we're just creating a foundation, right? It's an environment to heal. That's it. So it would depend on what actually happened to her. I mean, if there's some tears in there and going on and everything else, I probably can't do anything with that. But if she's going in for knee surgery, I'd be very interested in, well, what's her history with her ankle and her hip?
Yeah.
That's what I'm interested in.
Yeah.
So all those things together with her history, the medical diagnosis, and then what, that specifically the hip and the ankle, what's going on there, I can make it, sort of a determination on whether I can help her or not. But if it's, so my mother, I was actually working with her. She had the first hip surgery, and the problem, the anterior part of the hip, when you have that, what actually happens is it starts shutting down the immediate front side of the body. So that's the quads, the side, the glute medius, the psoas, they go dead. They don't really tell you that. So it's in the medical literature, but the hospital's not going to tell the doctors. The doctors have a job. They're just solving the problem, right? That's the hip surgery. That's the replacement. Anything after that, they're not going into that kind of detail. So that's something I would have to, in her case. She had wound up having a second one while I was working on the first one. But she was stage 3. So I think they've changed it to 5 stages. But anyway, she was on the worst level, it turns out. So I couldn't save that leg. She had to go in for the second surgery. Then after that, I rebuilt her.
Also, you in same like you mentioned scars.
Yes.
You work with scar tissue. So when you make that correction, scar tissue goes away, or are you working directly on scar tissue?
No, I'd work directly on the scar tissue. It doesn't go away.
Okay.
It'll still be there. But the scars heal by pulling in certain directions. So what I can go in and find out is test the muscles. Like, for example, this was really fascinating when I learned it. It's crazy. But I would go in on all aspects of the scar and move the scar in different directions. We call it vectoring the scar. And while I would do that, so for example, with my mother, her quad, the front leg, didn't work at all. So I'd just go in and push after the surgery. So moving the scar around and going up and down this long of a scar, I could find the direction of the scar, which relaxes everything around enough to where strength comes back to the leg. So twice a day, what she would do is that, she had it on 2 legs. I'm trying to figure out which one. One in, I think this side. It was towards the top of the scar, and it was a pull upward. And that brought the leg back on. So twice a day, what she would do is do that, hold the scar for about 2 minutes, let it relax, let that thickness kind of tone down a little bit, and then just do some quad exercises. And I don't know, I think before it really started coming back is probably 4 months, I think, of doing that. But I mean, now she comes in, and I actually got to see her later today, but she just comes in and her leg's strong. It's amazing. So the same thing happened with her psoas up here. That was gone, and the glute med was gone. So this was rebuilding all of those. Yeah. It's really fascinating. Any more? Oh, I'm sorry?
Did you say where you were located?
Oh, well, I stay in Benicia, but I come up here, and yeah.
Do you come to? I was going to say, do you go to clients, or do you have a space that they come to you?
That I'm developing right now up here. So, but I could go to clients also. Yeah.
Quick, what's that level, that certification levels that they talk about? I just went on the website and they said there's like 3 levels of certification.
Yes, it is.
I don't understand what does it allow you to do or not do things, or is this an educational level, or?
Yeah, it's an educational level. So the first level, I just recently took the third level. That's the last level, the top level. So the first level is just a general, it's the general testing and the processes, the basic algorithms that are used for the body. The second level is where the real stuff happens. And that's, as I was showing you on here, it's looking at the body as a system and patterns of the system and what is compensating more in a bigger picture. So it's more of the relationships of the whole body. So there's a lot, for example, we do things on compression of the shoulder and the hips. We get in there, eventually we have the hip surgery. It's how to decompress. There's also rotational patterns of our body and how to get our body back straight. There's also a lot of gait. There's certain movements we're supposed to have with our body as we move. So when we have imbalances, we start doing other stuff. So it's how to correct those things. So that's very detailed. Level 3, which I just took, is it's very specific on things. So it's ligaments, as I was talking about with my ankle. Ligaments in the ankle, hips, chest, shoulder. We did, which is really fascinating, eye muscles. So, believe it or not, and this is what happened to me also, is when we get off center, we start using certain eye muscles a little differently. And that reinforces the pattern, the compensation pattern. So if I'm having something too strong here and not strong enough over here, I might be twisted a little bit, right? And it's absolutely fascinating when you start releasing the eye muscles, all of a sudden it's a whole change if you've been doing it one way for a whole time, and it allows your body to relax a little bit more and get straightened out. We did a lot of stuff on, this is more how to keep the body centered and balanced. So there's a hyoid, there's a bone in our body here, the only bone in the body that does not attach to another bone. That's here. And all the muscles around here and the rotation that occurs with this hyoid, or lack of movement up or down. So if this, and this is what happened with my neck, come to find out, this side was very painful over here. And it turned me to the side. So I was just kind of like this until I figured this out, and you release that, and you're like, oh my gosh, whole difference. So the level 3 is very, just kind of one-offs, very specific things. Yeah. Go ahead.
Is this effective on scoliosis?
Yes, I've worked with somebody with scoliosis, minor scoliosis. So there could be some very serious things going on. But, it didn't come to find out, I had a little bit of scoliosis because of my back surgery. If we have hip issues or something like that, we can get very minor scoliosis. But therein lies, it could be this hardware issue, and it could be muscle issue, it could be all kinds of things. Go ahead.
So NKT is not your invention?
No, I wish, because this is really getting popular around the world now. It's being taught, and the guy's doing very well who invented this right now.
So you said you traveled and you learn things and come back and
Yes.
So did you eventually come upon NKT, or was that just, and then someone worked on you? And
Yes. Yeah, it was. I actually found it while I was still working. I probably went to 12 different places or people, or just did all kinds of different things. There was a guy up in El Dorado Hills at the time, and he does more, younger people sports type stuff. But he was NKT certified, and I went into him, and he explained it to me, and I started doing some things, went through the process, and I'm like, this is how things are supposed to work. This is ingenious. So that's what led me. It just took me a few years to actually jump fully into it. So around the world, I did just some other stuff, like rehab stuff. I took a breathing class over in Asia, how we're actually supposed to breathe and why. Just random things like that just added kind of to my knowledge. So.
And the founder's in Marin, you said.
Yes, he's been in Marin. He actually came up with, there was kind of I don't know the complete intimate details, but there was a group of people, kind of radical people or something, back in the day. Like physical therapist people or something like that, and they weren't happy with how things were going, and so they started researching all this stuff, and he came up with this whole idea, these whole concepts, and he refined it ever since, and he met some very good people who added to it. That's part of their group. They're kind of under him. And they started, bringing it out to the world, United States, but then it's gone international. It's Brazil, all over Asia, Middle East. It's down in Mexico now. So it was probably around 2011, it really started taking off. There was a big uptick.
Well, is that when muscle testing started coming into vogue? Like, you go to basic loan, test your weakness this way?
Very possible.
Yeah, that's farther back. Way farther back. Yeah, muscle testing is a long time.
Yeah, there's different types of muscle testing. So somebody could do a variation of testing your shoulder, right? So that probably goes back to whatever the founding of physical therapy was, type thing. And different modalities in this space, they have different ways of doing things, or one might improve upon another one. And you just kind of take what works and try and apply it to each individual.
But it is part of the NKT. It seemed like
Oh, the muscle testing is, yes. Yes, absolutely. Absolutely. Yeah. Any more?
It almost seems like, for me, like going through the healing journey, it almost seems like when you meet practitioners, those practitioners also went through something and they're trying to help other people. Because when you go to doctors, you're like, oh, it hurts. They're like, we'll take Tylenol.
Right.
You meet people, like Dr. Crusade and yourself, like you went through trauma yourself, so you're like, now I want to help other people, right? So
Yeah.
So you fully understand what other people are going through, which is nice, right?
Yes. Thank you. Yes. It was, as I mentioned before, I sort of got rushed and pushed into this. I had a presentation here that we were trying to set up, and
In the old clinic, remember we did one when you were learning a lot about nutrition?
yes, did that one. And then, so my parents, they got back into the gym, so they're running around the gym, and people in their classes started going, how you were in bed, couldn't move, a couple of months ago. What the heck happened to you? Or how'd you get through that surgery so fast, or whatever else? And my son just cleaned us up pretty much. And I couldn't believe it either myself. I still don't believe this stuff. And, so then they're like, well, can you introduce me to your son? And then so people started coming, and then I'm like, well, I guess I better do something with this. And I like seeing people happy, so I just ran with it. And then I have people like Desi, who welcomes me in here to give a presentation. So Thank you.
We are so grateful for you.
Well, thank you very much. I'm just glad to share. I'll come back anytime. That's it. As I keep learning about this. Thank you, really. Thank you guys for coming. Appreciate it.